Now, you mentioned that obviously autoimmune conditions are when the immune system starts to see our normal cells and tissues and organs as a dangerous invader. You said that things like toxins in the environment and in our foods could be causing this. Could you be a little more specific as to what might be taunting our immune systems?
Right, absolutely. First thing we do here at my office is we check for heavy metals, because we know, and it's in the traditional medical literature, that heavy metals like lead, mercury, arsenic, they will cause and instigate immune dysfunction and hence autoimmunity. So anytime we see autoimmunity, we're always led to make sure we test for heavy metal toxicity. So that's our primary source that we believe is at least a major instigator of autoimmunity.
Okay.
Gluten also, by the way, in the diet
Okay.
is extremely important to check for sensitivities and allergies. That's a major instigator of autoimmunity. We also see diseases like Lyme, chlamydia, Epstein-Barr viruses can be the initiator of autoimmunity. So we end up having to test for all these triggers, so to speak, for autoimmune responses. But generally, number one are heavy metals, and number two are gluten sensitivities.
Okay. Okay, that's an interesting comment, because I think a lot of people are aware of the gluten issue nowadays, and there's so much gluten-free around us. But I don't think so many people are thinking about heavy metals and how dangerous they can be.
Yeah,
can you elaborate on that a little bit?
It's a great point. It's really, for me, it's very mind-boggling that traditional medicine, since all the literature about toxicity of heavy metals is in traditional literature, but no one even in the traditional realm, internists, family physicians, hospital, no one tests for it. And to our practice here at the Salerno Center, it's as routine as testing for cholesterol.
Absolutely.
And the literature really is strong on what these metals, particularly chronic exposure, can do to not only the immune system, but to the rest of our health.
The brain especially, right?
Absolutely. So it really should be part of everyone's format for initial workup in a medical facility. You need to test for heavy metals, clearly.
Sure. Absolutely. And correct me if I'm wrong, is leaky gut a factor too? Because if the intestinal tract is too porous, that could allow toxins and so forth to seep into the bloodstream and taunt the immune system.
Absolutely. And that's key, and that's where these food sensitivities and gluten come into play, and or lack of digestive enzymes and probiotics, which we use as an arsenal to attack the issues related to autoimmunity.
Since autoimmune diseases can be such a challenge, I think a lot of people that have these conditions, MS, lupus, rheumatoid arthritis, you name it, I think they can feel hopeless a lot of times, because I think a lot of their options are just strictly medications to control the symptoms, maybe, to shut down the immune system. Can you recommend any more natural protocols that people can undertake to get some relief from some of these conditions and have some hope?
Yes, absolutely. One of the most important nutrients that anyone that has any autoimmune response has to be on, and at very high doses, which we measure here by blood tests, is vitamin D.
Oh, okay.
And vitamin D is extremely important to essentially modulate the immune system in autoimmune disease. So whether it be MS or lupus or rheumatoid arthritis, all our patients have extraordinarily high levels, and we keep them there, of vitamin D.
Okay.
So that's part A, and patients should of course have that monitored by their physicians and the blood levels, because too much of vitamin D can be toxic to the liver, but we still want to keep it at a very high range. Secondarily, we always start instigating a type of diet which is gluten-free and low carb, which is very important, both of which will reduce inflammation and would help to also modulate the immune system. There's a huge amount of inflammation, as you could imagine. It's very important too that we chelate, that we do IV chelation, so that we can eliminate the toxic metals, which are a major instigator, as we had mentioned, for autoimmune response. So those are the three primary approaches. When there's leaky gut involved, we'll do intravenous IVs, because these patients can't absorb nutrients until we can start healing the gut, so they absorb it. So the IV department gets quite busy on these patients to initially get their nutrients and their vitamin status up to par, because we measure that. We do blood tests routinely for vitamin levels. And when they're deficient, we also want to make sure that those levels come back to where they should be. And then we also find that believe it or not, bioidentical hormones help with autoimmunity. So
I didn't know that.
testosterone in men is a major player in helping to modulate and help autoimmune responses. Same thing with estrogen, progesterone, and testosterone in women. So we always want to monitor that, and that's used as an arsenal to treat these patients.
Would you elaborate a little bit on the bioidentical hormone therapy? As amazing as it is, I think a lot of people still aren't aware of it and and what it's all about.
Oh, sure, yeah, absolutely. What we do is we do hormones that mimic the body's own production. In a sense, they're exactly chemically, structurally the same, and hence we call them bioidentical. So estrogen is actually what I would give my patient is actually what your body is producing, chemically exact. So it's not Premarin, which is a synthetic form of hormone, to which hormones got a bad name. So these bioidentical hormones are preventative for cancers and heart disease, and studies now are bearing that out.
That's fantastic, because usually when you hear about hormones, everyone says they cause cancer. And
Right.
this is, nothing could be farther from the truth with these.
Absolutely, right.
That's
And we're seeing
fantastic.
more and more evidence to that effect, for sure. And Premarin and Prempro and the synthetics, when the studies were done, they indicated increased risk of cancer and heart disease, but they're synthetic. These are showing just the opposite.
Like just natural support for your body, as if you were making them yourself.
Exactly.
Okay.
Right.
And how are they used? Are they a cream? Are they a liquid? Or what's the format?
We generally use creams for testosterone and estrogens, and we usually use progesterone as a capsule to be taken more at night, and that's the general rule of thumb.